Hi everyone, welcome to another Psych student video. Today we will be thinking about risk assessments. So when conducting a risk assessment, we're broadly looking at two types of situations that you might find yourself in. One is thinking about a person's risk in general terms, so thinking about what factors might affect them. So if they use drugs, if they're in a particular age group, they might be more at risk of specific problems. Other times we're thinking about risk assessing after a specific incident has happened. So when we're thinking about general risk factors and the overall risk assessment of a person, we think about different categories of people who might be at risk. So risks to themselves, any risks they might present to other people around them. And then following on from that, any risks they might have in terms of dependence. So if they're caring for children, for elderly relatives, and even animals sometimes we'll take into account there as well. As if we're going to admit someone into hospital, we don't want to be leaving their pets at home without anyone to feed them. So when we think about each of those risk factors, there's specific questions we might be asking ourselves. If we're thinking about risk to self, we think about any self-harm potential, any suicide, self-neglect factors. So are they keeping well fed? Are they keeping good hygiene? When we think about harm to others, we're thinking more about if they've had any thoughts about wanting to harm anyone else, particularly if there's delusional content or command voices. And as I say, when we think about dependence, we're thinking about anyone that they might be responsible for. So it might be in these situations that we have to involve specific people, so safeguarding, potentially police if there's real concerns about risk to other people, child protection, and the RSPCA in terms of animal care issues. Following on from that, we think about more general risks again, what they're up to in their day-to-day life. So are they driving, particularly if, for example, you're looking at diagnoses such as dementia, where they might need to inform the DVLA. Have they got access to anything at home that could potentially be a problem? So have they been able to stockpile medication maybe? Are they someone who has access to weapons? For example, if you're dealing with a person that's maybe working out on a farm, they might have access to firearms or kind of all sorts of other situations as well. And then we think about any physical health issues. So potentially an older person who might be at risk of falls, they're leaving the cooker on because they're not well cognitively. And then we think about all of that within the kind of context of that person. So their past history is really important here. It might well be that they've been in trouble with the criminal justice system before. So if they've served sentences, particularly for kind of violent and aggressive behaviour, we want to know about that when we're thinking about their risks. If they've been into hospital before, that might help us to assess, for example, the extent of the risks to themselves. Have they been in ITU before? And then when else we've seen them in the past. So have they come to clinic? Did they come as a child? When did we first access them as a mental health service? When we move on to thinking about a specific event, so this might be an event of harm to other people, it might have been at risk of harm to self that has now come forward, so potential suicidal act. So we think about this in terms of before, during, and after, kind of in the same way we might think about someone who's had a seizure. So planning before they did whatever the event was, did they write any letters to tell people what they were going to do? Did they change their will? Did they think about care for their dependents? Did they make any moves to avoid discovery or to kind of hide it if it was an offence? And did they have a specific date or time in mind, or was this a really impulsive phenomena? During the event, we think about kind of where they were, when they were, how they did whatever it was that they did. And what they felt at the time is really important to understand. When we think about what expectations they had, what I mean by this is if, for example, they took an overdose of medication, did they think that this would harm them? Did they think that it would kill them? Because whilst we might, as professionals, know how much would be a problem, it potentially might be that they have a different understanding of what was going to happen. And then we think about how the issue was discovered and how they feel about things now. So what are their plans for the future? Do they feel guilty? Do they regret any of the actions that they took? And when we think about plans for the future, we're also thinking about positive plans. So do they think actually this was something I regretted happening? Now what I want to do is go and get my degree, or any other plans or ambitions. And we think about what support they have as well. If they're at home, if they got people with them. Thinking more about support as a whole, this really does factor into our risk assessment and what we need to do. So when we're doing risk assessments, we're thinking about what we can do to help. Do they need to come into hospital? Can they go home? Have they got people at home with them? Do we need urgent outpatient appointments to give them more support in the kind of more immediate term in the community? Can they access a specialist personality disorder service of some description? Lots of different areas will have access to different things. And then we think about their family and friends, their social structure. Have they got people checking in on them? Is there a role for any medication in this case, or do we need to be maybe thinking about writing to their GP and asking them to provide less medication at a time to help with kind of limiting access to medication volumes? Potentially we might need social services involvement and supported accommodation, or children's services involvement, for example CAMS, so that's child and adolescent mental health care. And there might need to be safeguarding in place, and drug and alcohol services will help to reduce risks if that's a problem for them. And we're thinking about whether or not we need to involve the Mental Health Act or the Mental Capacity Act in these situations. Whatever the risk might be, things change, and we know our risk assessments are far from perfect. So in any situation where you're talking to a person about risk, make sure they know who to contact if things get worse or if things change. You don't know what will happen to that person when they go back to their lives after they've met with you. Thank you for watching this video. I hope this has been helpful. Please do like, subscribe and share, and check out our website if you enjoyed the video. Thanks.